My name is Margaret. I am a nurse who has been working with the Cameroon Baptist Convention Health Services for over 40 years. I started working with this establishment in 1980 when I was a nursing assistant. During all the years of my work, I had the opportunity to go into different levels of training, such as training for SRN, State Registered Nursing. I also had an opportunity to go in and do practitioner, and I had several in-service training that qualified me to function at different levels. I have had the opportunity to teach in the private training school for health personnel. The private school for health personnel is a school where the CBC train their nurses. I also had an opportunity to go back and work there as the principal of the training school, where I earned a certificate of excellent leadership skills. During my work career, I've functioned as a chief of center, and I've had to be the pioneer chief of centers for a couple of health centers, beginning with health centers in the urban area like in Douala, in Bafoussam, in Mutengene. I've also worked as a nursing supervisor of hospitals. When the Baptist Hospital in Mutengene was raised from a health center to a hospital, during my 2 years of work, I had to serve in Basel Baptist Hospital as a supervisor of nursing services, besides other managerial assignments that I've had to serve in. Throughout my career, I have been burdened with people both in the rural areas, even in big towns, who suffer from various diseases. Some are preventable, some have complicated treatments, but some just need to be educated on how to live well. Anemia is such a rampant thing in big towns because people they don't know what to eat, besides the fact that living in a town is expensive. There are things like gastroenteritis due to poor water systems. There is malaria, which is an endemic disease in Cameroon, and people tend to have wrong treatment, and then they end up having complications because they have not been well treated. Oftentimes, people go to the roadside to buy expired drugs. My passion has always been to help people use the skills that I acquired in my working career and be available to people, especially in remote areas in these big towns. There are high-level clinics where people cannot afford to go, but having a health center at their level where they can easily come and meet us. This passion could not rest until I started a health center with the approval of the government, and had to bring some people to work with me because no one can do it alone. The motto of this health center is to provide services to humanity, because I realized that they needed help. From the onset, I had a team of 13 workers. There was a medical doctor, there were 2 lab technicians, there were technical people that are well trained. But with time, we have trimmed them down to 5 because we are not able to maintain them. We have gone out on sensitization on several occasions to let people know that we are there for them. We had tried to do an open healthcare provision where people will come and check their blood pressure, check their weight, and do some basic lab tests, just so that they know that we are there and then we can help them. It has failed woefully because we cannot go out and leave the health center alone. Staff have been trimmed down to 6. Meanwhile, we started like 13. We couldn't maintain the medical doctor that attracted people. You know, people have to come to a place where they know that the personnel are well trained. And having a medical doctor on sick was a boast when we started. But we don't have that medical doctor again. We reduced the lab staff to 1 because we couldn't run the health center during the day and during the night with 2 lab technicians. We couldn't pay them, so we just have 1. Besides that, we have provision to provide antenatal clinics, do deliveries. We had 3 midwives. We have come down only to 1 because if we maintain the 3 midwives, we will not be able to pay. Besides all of this, our water system has not been functioning because we couldn't pay the bills. So now we use only a borehole water system where we have to boil the water and make them fit for drinking. It has been very challenging, but this burning desire cannot be given up because it is something that I conceived during my working years, and at this juncture, I'm not able to go without help. We need help to be able to recruit professionals, qualified nurses, medical professionals. People come and ask for a pediatrician because all of this stems down to the fact that people do not use this health center as they're supposed to because one, staff has been reduced, they don't have a doctor, and they may not trust the ability of nurses to really consult. When we started off, we knew that there was going to be a medical doctor who does prescription, but because of lack of finances to pay, the doctor left. The intention to start a health center in this environment where we are was built on a certain capital. The running capital stems from the fact that I was saving a portion of my salary with the National Social Insurance. There was also a lump sum that was paid to me called severance pay. The two sums could not help me to get a loan to start a health center. So I had loans too from friends who gave me some money to add so that I can start. We started this health center with the sum of about $75,000. This money was generated from my savings during work, loans from the bank, some donations from friends. We are still owing about $50,000. We are working in a rented apartment where we pay rent yearly. We have really been in a tight corner because rental fee has increased, prices have increased, and it is affecting our services even because the drugs are usually not there. At this juncture, I really feel that I need help so that I can be able to continue with this vision, providing healthcare to humanity as a service for people who do not have it. We have already put in a lot of equipment. Some of it is on loan, and it is not possible for us to stop because even though people cannot pay their bills, we cannot send them away because our motto is to provide service to humanity. When they rush in very sick, they've often complained about the inability to pay bills, but we cannot send them away, so we treat them and the bills are pending. At this moment, we have about $700 to $800 bills unpaid, and it makes our work very difficult. People value our services here, but they cannot pay. At this level, we need to have a resident medical doctor. We need to have 3 midwives because we have a maternity. We need to add 6 nurses to the 3 that are now for proper coverage. We need to have 6 nurses to go out for sensitization. We need to have an additional lab technician. There is a high need of ultrasound, echography, and then we need to hire a sonographer. We also need a standby generator because the issue of electricity is off and on in Cameroon is very high. We need to reinstate our snake water so that we have pipe-borne water because as of now we are using the borehole. Besides that, the rates are very high. There are times we have lab investigations to carry out. The reagents are not there. Sometimes the hemoglobin machine is broken, we cannot repair. We cannot buy a new one. Talking about medications, people come even for essential drugs and the drugs are out of stock and we cannot replace because there's no money. The little money that is left in the coffers is used to pay rents. This is so frustrating that when they come here, they know that this is their final place to have help, and yet they have to go away without help. If we need to be able to stock up well, and above all, it is important for us to be able to acquire land, build our own health center, so that the money we are using to pay rents can be refocused to help the people in the community. In the course of functioning and receiving clients, we have realized that some people come in with chronic diseases, cancers, and on palliation. In the course of our functioning here, we have seen that some people come in with depression, some have multi-somatic complaints, some even on palliative care. And for this reason, we have seen the need for a chaplain who will listen to them, pray with them, and encourage them to have a chaplain in our team. The climate of Douala is very hot. Temperatures are very harsh. We need air conditioning system in our health center. We need mosquito nets. We need security guards. We need at least 2 cleaners, because at the moment it is the nurses on duty that do the cleaning. This is where we find ourselves. We are not able to give up this vision because it is fruitful, it is helping, but we are limited. We are pleading. We need you to help us so that we can continue this vision and provide health care to people in this community. May the Almighty God bless you while we remain hopeful that we'll hear from you. Thank you very much.